Hello, everyone. My name is Mitisha Gupta, and I am your host for today's podcast, Win Over Hypertension, where you can learn how to take care of your blood pressure through exclusive insights and practical advice. Today, we're talking all things about hypertension, why is it caused, how it matters, and most importantly, how to take care of it effectively. Hello, doctor. It's my honor to have you on this podcast today.
I am Dr. Gaur, Senior Consultant Internal Medicine at Bhagat Hospitals Private Limited and my own clinic, Care and Cure, Dr. Gaur Specialist Clinic.
So, doctor, by now we all know what hypertension is. But can you please elaborate on it? I mean, why is it so important for us to take care of ourselves even when we feel fine?
Well, if we are feeling fine, and it doesn't mean that feeling fine is absolutely alright and you should not get yourself checked up, because hypertension is a silent killer. If you do not get your BP checked up regularly, it is likely that if you have a hypertension, it can affect all your symptoms, including your cardiovascular system, your nervous system. It can affect your kidneys also, and it can lead to dementia and forgetfulness also. So it is very essential, whether you are having symptoms or not, after a certain age, you must regularly get your BP checked up.
So, doctor, I would like to know, what are the most common reasons people develop high blood pressure? Is it genetics, lifestyle, or something else?
There are a number of factors which are responsible for development of hypertension. First and foremost, the lifestyle which is there nowadays, in which there is a lack of exercise, eating of fast food, and lack of sleep. These are very important causes for hypertension. However, if a person has got a family history of hypertension, there is genetic predisposition, and these patients are more likely to develop hypertension if they do not lead a healthy lifestyle. Nowadays, as we see, people eat a lot of food from outside. They have lack of exercise, generally sedentary lifestyle, and lack of sleep. So genetic factors as well as environmental factors, they do play a very important role in evolution of hypertension.
How is blood pressure exactly diagnosed? When looking at the blood pressure readings, can you elaborate on the exact numbers people should be looking at?
Hypertension can only be diagnosed whether you are having symptoms or not. You must regularly get your BP checked up. Now, earlier there used to be a dictum that BP of 140/90 is normal, and anything above that was considered to be a hypertension. But however, with the JNC guidelines, that the parameters have changed. Now a BP of 130/80 is considered to be normal. Anything above that is considered to be having a hypertension.
So I would also like to know, if someone has just been diagnosed with high blood pressure, what are the changes you would want them to make in their daily routine?
If you have been diagnosed hypertension, first thing you should introduce is the lifestyle modification. And in the lifestyle, the most important thing which I am going to elaborate is, first is the diet. Your diet should be low in salt, and it should not contain saturated fats like ghee, butter, full cream, milk, and all those things should be avoided. Other than the diet, you should also increase a lot of fiber in your diet. Eat plenty of fruits and vegetables. Other than the salt, as ghee, as I have already mentioned, other thing is a proper sleep. One should sleep for at least 8 hours a day. Other than that, plenty of fluids orally should be taken. In addition to this, stress should be avoided, because that is killer number one nowadays as far as hypertension and cardiac illnesses are concerned.
Can we say that hypertension can be treated without medication?
Well, if you are having a mild hypertension, then if you introduce the lifestyle modifications in your daily routine, they may help you to bring down the blood pressure levels, and in that case you may not require medications. However, if you have a moderate or high hypertension, then medications are must, and they need to be taken on a regular basis, other than the lifestyle modification which I have just mentioned.
Okay, doctor, you just talked about medication right now. So I would like to know, what are the most common side effects that people should look out for while taking medications for hypertension?
Well, there are a number of medications which are used for treating hypertension. Each medication has got its specific side effects, which a doctor can tell you always. So it is very important for you to follow the doctor regularly. Like certain group of medications like ACE inhibitors, in which the card is ramipril, there are a lot of medications. Their important side effect is cough, and one should be aware of that. Along with that, the medications like beta blocker, they do have certain side effects like feeling of lethargy, weakness, and even at times the sexual dysfunctions are there. Certain medications like minipress XL, that can also lead to postural hypertension. So each medication has got its side effects. Only thing is you must follow it regularly with your physician. He is the one who will be able to detect it as early as possible and change the proper medications.
Okay, when you say reassess regularly, how often people should check their blood pressure and what's the best way to do it right?
Depends. If your BP is fairly well controlled, then you can check it once a week. However, if you are on a medication and still in the process of dose titration, BP should be checked at least 2 to 3 times a day. And the correct way of taking the blood pressure is that you take a proper rest for 3 to 5 minutes before checking your BP. Put it on a right arm. The BP instrument should be at the heart level, and 2 to 3 consecutive readings at an interval of 1 minute should be taken, and average of that should be taken as the correct BP.
I would also like to know what would happen if high blood pressure gets untreated for years, especially the body parts which gets affected the most.
Hypertension, if not treated properly, can have devastating effects. It can affect the target organs, like most important organs like your brain. Stroke is a very important complication. In that case, left ventricular hypertrophy and cardiovascular diseases. It can lead to kidney failure. It can also lead to dementia. So that is why the control of blood pressure is very important. Otherwise, it can affect the eyes also, leading to impairment of vision also.
And what parts of the body gets affected the most?
The hypertension affects all organs in the body, mainly because of the process of atherosclerosis, that is the deposition of fat in the arteries and hardening of the arteries. This can lead to the plaque formation. The rupture of plaque can give rise to the heart attack. It can also affect the kidneys in terms of kidney failure. It can affect the vision in the form of retinopathy, can affect the brain also in the form of stroke or dementia. However, properly controlling the medications, the BP with medications, can definitely lead to the reduction in the onset of all these complications. The stroke can be reduced by around 35%, as well as the cardiovascular other disorders like heart attack can be reduced by approximately 25% by proper control of hypertension with medications.
So this marks the end of our podcast, Win Over Hypertension. I would like to say a huge thank you to the doctor for sharing such valuable insights to us. Remember, hypertension isn't just a number, it's a signal. And with right knowledge and action, it's absolutely preventable. If you found this episode helpful, do not forget to like, share and subscribe and share your valuable insights with us. Always remember, stay informed, stay proactive, and most importantly, stay healthy. This is Mitisha Gupta signing off from this podcast, Win Over Hypertension.